There is a specific area in your body that, when massaged with coconut oil, can activate circulation and completely transform your sexual life, even though almost no one dares to mention it. Sounds incredible, right? But after more than 20 years working with men on intimate health, I can assure you that the changes I have seen in those who adopt this simple habit are remarkable. After the age of 50, many men notice a decline in their sexual performance. Erections are less firm, desire decreases, insecurity rises. They often blame age, stress, or simply accept it as normal, but it is not. In most cases, it is not about hormones or testosterone, but something more fundamental: blood circulation. Today, I want to show you a completely natural method that I have incorporated into my clinical practice. A protocol that can not only restore potency and firmness, but also strengthens the health of your blood vessels, increases energy, and boosts self-esteem. And if you stay with me until the end, I will reveal a secret morning drink used in regions where men maintain an active sexual life even into their 90s, which you can prepare at home and start drinking tomorrow. Are you ready to discover what no one has told you about your body and your true masculine potential? Let's go. Many men come to my practice convinced that their problem is hormonal. They ask about testosterone, pills, or supplements. But when we review tests and medical history, the cause is usually something else, more silent and often overlooked: poor blood circulation. To understand this, we first need to know how an erection occurs. The penis contains two main structures called the corpora cavernosa. They function like sponges that, when they receive the signal from the brain, fill with blood. The faster and more blood that flows into them, the firmer and longer lasting the erection will be. The problem is that as we age, blood vessels deteriorate, lose elasticity, become inflamed, accumulate fatty plaques or calcium, and become stiff. This process, known as endothelial dysfunction, limits the penis's ability to fill with blood. Added to this is a decrease in the production of nitric oxide, a key molecule that acts like a switch to open the blood vessels. Without enough nitric oxide, the vessels cannot expand, and without expansion, there is no erection. The most concerning part is that these changes are not always accompanied by other symptoms. You can have compromised circulation without noticing it. In fact, several studies show that erectile dysfunction can be the first sign of an underlying cardiovascular problem. An article in the Journal of Sexual Medicine reported that up to 70% of men with erectile dysfunction show signs of undiagnosed heart issues. In other words, what seems like only a bedroom problem can be the first warning of a heart attack or stroke. Why am I telling you this? Because understanding that an erection is a vascular phenomenon allows us to see that any treatment must start by improving the health of the blood vessels. This is where everything I am going to share with you makes sense. From simple techniques like a specific massage to a natural drink that helps restore vessel elasticity from the inside, the good news is that circulation can improve. The body responds quickly when it receives the right stimuli. In my experience, I have seen men over 60 regain their potency by making small but consistent changes. And the best part, without medication, without side effects, and without needing a pill every time they want to feel alive. One of the most common mistakes in men over 50 is accepting erectile dysfunction as an inevitable fate. I hear it all the time in practice. It's normal, I'm at my age. Oh, I'm not a young guy anymore. What can you do? This way of thinking not only reflects resignation, but also prevents many men from seeking real and lasting solutions, which do exist and do not depend on pills or magical formulas. For over 20 years treating patients with sexual health issues, I have seen how this limiting belief becomes a mental barrier. Some have spent thousands of dollars on temporary pills that offer only momentary results without addressing the root of the problem. Others try supplements, unsupervised hormone therapy, or home remedies without scientific support. The result is usually the same: frustration, dependency, and sometimes side effects that harm other areas of their health. The most concerning thing is that many do not even consider that the cause may be something as basic as their blood circulation. When arteries lose elasticity, become inflamed, or accumulate fat, blood flow to the penis is reduced. Without good blood flow, There is no firmness or response. But what most people don't know is that this process can be reversed. Not with magic, but with small changes that, when accumulated, create a significant impact. Move more, stay properly hydrated, sleep better, eat consciously, and follow certain natural protocols that stimulate circulation exactly where it is needed. I particularly remember the case of Matthew, a 64-year-old patient who came after relying on medication for years, needing higher doses each time. He felt exhausted, had no desire, no energy. When we reviewed his routine, we discovered that he walked very little, had a poor diet, occasionally smoked, and slept badly. I suggested something to him that at first seemed too simple: temporarily stop the pills and start a natural protocol with daily massages using coconut oil on the perineal area and a morning drink rich in vasodilating compounds. 10 days later, he wrote to me surprised. He was having more morning erections. He felt more energized, more alive. After a month, he completely stopped the medications. His self-esteem recovered, and his romantic relationship experienced a remarkable improvement. This is not an isolated case. I have seen it repeat in many men who, by refusing to resign themselves and choosing to care for their body differently, recover much more than sexual function. They regain confidence, vitality, and a connection with themselves. That's why I want you to be clear. Don't confuse aging with decline. Your body is not broken. It's just waiting for you to decide to activate it again, from the inside, with what it really needs. I didn't discover the true potential of coconut oil at a conference or in a scientific article. I discovered it by listening to a patient who, after years of frustration with conventional treatments, told me he started noticing improvements after a small nightly ritual, massaging himself with warm coconut oil on the base of the penis and the perineal area. At first, I was skeptical, as is common with things that seem too simple to be real, but my clinical experience taught me that direct observation is as valuable as any study, so I decided to investigate further. I discovered that coconut oil has properties that improve circulation, reduce inflammation, and protect blood vessels. Thanks to its lauric acid and medium-chain triglyceride content, it not only supports metabolism, but also improves vascular elasticity. Additionally, it naturally stimulates the production of nitric oxide, a molecule crucial for blood vessel dilation. Without nitric oxide, vessels don't expand, and without expansion, there is no erection. The perineal area, that space between the testicles and the anus, is crossed by a dense network of vessels and nerve endings directly connected to the corpora cavernosa of the penis. Applying coconut oil through a gentle, mindful massage in this region can unlock dormant microcirculation and reactivate responses that seemed lost. I'm not talking about magic or miracle solutions, but pure physiology, stimulating the right area with the right stimulus. After verifying it with several patients, I began including it as a standard recommendation in my protocols. Within a few weeks, the results were consistent: better blood flow, increased sensitivity, and more spontaneous erections. Some even noticed improvements in sleep and mood, which didn't surprise me. When the body starts functioning as it should, everything improves. I also realized that coconut oil not only serves as a medium for the massage, but protects the sensitive skin in the intimate area, prevents irritation, fights fungal infections, and keeps the tissue hydrated. This is especially important for older men, whose skin tends to dry out or become damaged easily. Today, I continue recommending this simple nightly habit. It doesn't replace medical treatments when needed, but it can make a huge difference for those who want to regain control of their body naturally. And the most powerful part, it costs almost nothing. It's accessible to anyone and can be done with complete privacy. Sometimes, the most effective solutions are right in front of us. You just need to open your mind and dare to try. After understanding the importance of circulation for male intimate health, I developed an external application protocol that many of my patients have adopted with excellent results. It is not invasive or complicated. It is a simple, discreet, and highly effective gesture when done consistently and attentively. The key is stimulating a strategic area of the male body, the region between the base of the penis and the perineum, the space between the testicles and the anus. This area contains numerous blood vessels and nerve endings directly linked to erectile function. By applying a gentle massage with warm coconut oil there, local microcirculation improves and the natural processes of vascular response are activated. The procedure is very simple. You only need a teaspoon of extra virgin coconut oil, preferably cold-pressed. Warm it slightly until it is lukewarm, never hot, and place it on the tips of your fingers. Then, in a quiet and relaxed environment, gently massage the lower intimate area, starting from the base of the member and moving toward the perineum. Make slow circular motions without pressing too hard. The goal is not sexual stimulation, but to unblock circulation. During the massage, breathe deeply and keep your body relaxed. This state of calm activates the parasympathetic nervous system, which promotes vasodilation and regeneration. The best time to practice this is at night, before going to sleep, since the body enters a natural repair process during rest. Repeating this gesture daily for at least 7 consecutive days can produce a noticeable change. Many men ask me whether this type of massage has real scientific support. My answer is clear. The clinical results speak for themselves. This is not a miraculous technique, but rather a conscious way to reconnect with your body, pay attention to a neglected area, and improve your health from its most essential foundation, blood flow. Integrating this habit into your nightly routine can not only improve sexual performance, but also strengthen your connection with yourself, your vitality, and overall well-being. Over the years, I have observed that men who combine this massage with a diet focused on vascular health achieve faster and more lasting results. For this reason, in addition to the external massage, I recommend a specific morning drink that works from within, strengthening the circulatory system and naturally enhancing male sexual function. This drink combines simple but highly effective ingredients. The first is extra virgin coconut oil, known for its anti-inflammatory properties and its ability to stimulate the production of nitric oxide, the molecule that dilates blood vessels. Taking it orally helps improve vessel elasticity and provides a clean source of energy that the body can use immediately. The second ingredient is beetroot juice, one of the vegetable's richest in natural nitrates. Once ingested, these nitrates are converted into nitric oxide, facilitating circulation throughout the body, including the intimate area. Many high-performance athletes consume beetroot to increase physical endurance, but its benefits go far beyond the gym. To this mixture, fresh orange or lemon juice is added, a powerful source of vitamin C that strengthens the immune system and protects blood vessels from oxidative damage. It also improves the absorption of active nutrients from the other ingredients. The fourth component is carrot, which provides beta-carotene and antioxidants that benefit cardiovascular health. Its mild flavor and texture make it ideal for any juice without altering the overall balance. Finally, a touch of fresh ginger, known for its mild vasodilating effect and ability to stimulate circulation, completes the formula. Preparing it is very simple. You need about 100 milliliters of natural beetroot juice, the juice of 1 orange or half a lemon, a small carrot, a piece of fresh ginger the size of a coin, and a teaspoon of coconut oil. Blend all the ingredients except the oil until you obtain a homogeneous liquid. Then add the lukewarm coconut oil, never hot, and stir well before drinking. Ideally, drink it on an empty stomach in the morning, when the body is most receptive and the circulatory system naturally activates after nighttime rest. Many men who try it notice, after 1 week, increased energy, better mood, and heightened sensitivity in their intimate life. Some even report feeling more alert and focused during the day, which makes sense, since improved circulation also enhances oxygenation of the brain. That said, like any natural recommendation, certain precautions must be considered. This drink is not suitable for people with uncontrolled diabetes due to the natural sugar in beetroot and citrus. It is also not recommended for those with very low blood pressure or those taking anticoagulants without first consulting a professional. With that said, for most healthy men, this drink is a simple, accessible, and powerful tool to start the day with a real boost of health and vitality. Combined with the nightly massage, it forms a complete, effective, and deeply respectful protocol for the male body. If you have made it this far, I first want to congratulate you. Not everyone takes the time to inform themselves, question what they have always believed, and open up to new solutions, especially when it comes to such an intimate topic. Sexual health, often surrounded by shame or silence, deserves the same attention and care as any other area of your well-being. Today we saw that male potency does not depend solely on age, hormone levels, or fast-acting pills. It depends largely on circulation. Without adequate blood flow, no structure in the body functions properly, including your intimate area. For this reason, erectile dysfunction is not a sentence, but a signal, a warning from your vascular system that deserves to be listened to and treated at the root. I have shared 2 natural and practical tools with you. First, the nightly coconut oil massage, applied consciously to a key area of your anatomy, which stimulates local microcirculation and reconnects your body with its natural response capacity. Then, a powerful morning drink, easy to prepare, full of compounds that nourish your arteries from within, improving their flexibility and function. These 2 practices, integrated into your daily routine, can generate a profound change, not only in your sexual life, but also in your energy, self-esteem, and sense of vitality. I have seen this repeated in men of all ages, especially after 50, when many believe their best days were behind them. However, with small, sustained gestures, transformation occurs. Now I invite you not to stay with only the information. Put it into practice. You do not need to buy anything unusual or follow complex treatments. Only decision and consistency are required. Do the massage tonight. Prepare the drink early tomorrow morning. Feel your body. Listen to its signals and trust its capacity to recover. And if this content has been useful to you, share it with someone else. We all know a brother, father, or friend who could benefit from this information. Instead of staying silent or making fun, it is time to speak with clarity, respect, and knowledge. Regaining your potency is not a matter of pride, but of health. Remember, aging is inevitable, but losing vigor is not. Every cell in your body wants to live, move, and respond. It only awaits your decision to give it what it needs. Thank you for accompanying me this far. As a specialist, but above all as a human being, I hope you take what you have learned and turn it into action. Because when you act, everything begins to change.